So let us now, as you know, there have been some discussions, and I would like to update the room that at lunchtime there was an information session, on the GDO business cases. In the interest of time, and before we proceed with the agenda item on aging is living, I would like to reopen the agenda item 7 to see if we can conclude this now. There were some interventions open and some discussions, and I feel it's important that we do that at this point and not at a later time point today. So before we open the floor, and I think we all agree that there should be full transparency in the process, and also to note the role of the SCRC, which is very important. So I would suggest that a standard paragraph is added to the decisions addressing this point on reporting on and the role of the SCRC. And I would read it now to you, and obviously we can discuss that then later. So the wording would be request the 33rd Standing Committee of the Regional Committee for Europe to report back to all member states at its open session on progress made in implementing this decision to ensure transparency and continued engagement of all member states prior to RC76. We think that with this, at least we have something written in there that it is also under the control of SCRC, which is the prolonged arm of RC, the regional committee, to be up to date, to be informed, and to keep all member states updated along the ride of getting to a potential decision at some point for a new GDO. All right, so I would like to open the floor for responses to the suggestion here, and I see that Norway, yes, that Norway raised the name tag. So please, you have the floor.
Thank you very much. Chair, Regional Director, dear colleagues, I have the honor to deliver this statement on behalf of Estonia, Denmark, Finland, Iceland, Latvia, Lithuania, Norway, and Sweden. As we have previously stated, we have significant concerns about setting in motion a process regarding 3 GDOs when we are not clear on the potential consequences. We do appreciate the range of views that we have heard both inside and outside this room, including about the urgency to move forward with some of the GDO business cases. We would also like to thank the Secretariat for acknowledging the raised concerns by arranging the informal session at lunch today, even though we would have preferred to have this discussion much earlier in the process. Although we maintain our skepticism regarding the timing of these decisions, for the sake of consensus, we would like to withdraw our proposed amendments to the decision documents for the 3 business cases that were circulated yesterday evening and support the amendment to the original decision that was proposed just now by the Chair. For the Nordic and Baltic countries, it is important that we treat all 3 of the GDO business cases in the same way. This will intrinsically contribute to transparent and future-proof governance for all GDOs in the broader context of the EPW and in line with the standard operating procedures and process for the establishment of the GDOs. Colleagues, we still encourage careful consideration in the Regional Committee about the implications of establishing GDOs in the midst of a reprioritization and reform process, and to carefully consider alignment with the critical activities both in the newly approved EPW 2 and the GPW 14. Priorities must be made in line with the reduction in the staff that has taken place in the organization due to the financial situation. We would therefore ask that the meeting report reflects that the coming year will be used to answer many of the critical questions that have been raised, both during the consultation in August, but also here at this year's Regional Committee, and that this information will be provided to the Member States well before we return to this issue next year. And then we'd also like to underline that an endorsement of the decisions now this year does not automatically mean that we will support the following decisions in the coming year. So thank you very much.
Thank you very much, Norway. And if there's no other, I would just like to continue where we stopped yesterday, when we had to suspend the session. And I would like to go on and ask Finland to take the floor if they're ready, and then afterwards Poland.
Thank you very much, Chair. Finland aligned itself with the statement delivered by Denmark on behalf of the European Union and its member states. We see accountability, transparency and trust as the foundations of WHO in Europe, and particularly in this period of financial pressures and organizational change. We are welcoming the continued emphasis on making WHO Europe a model workplace. Staff are the backbone of any organization. Their motivation and well-being must remain a top priority. The ongoing strategic reprioritization and restructuring process will inevitably have profound implications for personnel, and we therefore command the leadership's commitment to fostering respectful and supportive work environment. Finland supports clear monitoring and reporting on the Respectful Workplace Action Plan, with progress on staff well-being, retention and diversity reflected in the annual accountability report. Regarding the proposals of GDOs, Finland acknowledges the relevance of the three thematic areas as mentioned: AI, quality of care and patient safety, and the health and well-being economy. We believe that these should be treated as single package. The coming year should focus on preparatory work around financing, transparency and efficiency of all three potential GDOs. Therefore, we don't support fast-tracking any one GDO over the others. Thank you.
Thank you very much, Finland. I'd like to give the floor to Poland, followed by Belgium.
Dear Chair, sorry, but I need 2 more minutes, if it is okay for you. Thank you.
No problem. Let's see if Belgium is ready.
Sorry, Chair, it was...
so I didn't...
We don't mean to take the floor now.
No, that's good. Okay, good. I'll just go down my list. I have the Czech Republic here. Would you like to intervene?
Chair, Regional Director, distinguished delegates, ladies and gentlemen. The Czech Republic aligns itself with the statement delivered by Denmark on behalf of the European Union and its member states. We are grateful that the practice of issuing accountability reports is being preserved, as we consider them to be a valuable governance tool. This year, more than ever, it is important to share information and perspectives on the budgetary and governance matters and how these are influenced by the current financial constraints. The Czech Republic was intensively involved in the bilateral discussions regarding the WHO's presence in high-income EU countries, and we look forward to continuing this debate. We believe there is further potential for improvements and significant savings. We greatly appreciate the progress made in the dynamic field of AI tools. We believe that AI could free up staff who are sometimes overloaded with periodically repeated duties, enabling them to communicate directly with member states' representatives. In this context, we would like to thank the Regional Office for the briefings and bilateral talks held during the World Health Assembly. The provided support was exemplary. We would welcome more detailed information on the relocation to the enabling hub in Istanbul. We look forward to receiving information from the second review regarding the financial costs and benefits achieved. Furthermore, we highly value the work of the SCRC, and it is crucial that it remains a robust and effective body. Another way to raise awareness of their duties among the WHO membership could be to share the SCRC's activities more proactively. Disseminating the SCRC reports actively rather than publishing them statically on the website could be an easy first step in this endeavor. Last but not least, thank you very much for a consultative process regarding the business cases for the proposed GDOs and for organizing the related information briefing today. In line with our questions raised during this briefing, we would welcome further discussion regarding the possible expansion of the scope of some collaborating centers and not exclusively in the domains which should be covered by the 3 new GDOs. Thank you for attention.
Thank you very much, Czech Republic. I had yesterday Malta still on it, and Germany. Malta, do you want to take the floor? I know I'm just too fast now.
That's fine. Given the developments, I don't think we need speaking time. Thank you.
Thank you very much, Malta. Germany, how do you feel about it?
We always feel great about it. But it's a challenge, to be honest, but I'll try my best. Yeah. So thank you, Chair. Germany aligns itself with a statement delivered by Denmark on behalf of the European Union and its member states. We appreciate the comprehensive report on governance and partnerships, as well as the ongoing efforts to improve transparency, accountability, and the involvement of member states. We are encouraged by the steps made in enhancing participation in governance. The continued engagement with the SCRC and the European member states demonstrates the importance of inclusivity and cooperation in the decision-making process. Germany fully supports the commitment to strengthening these relationships and ensuring that all voices are heard, particularly in light of the financial constraints and the evolving global health landscape. A point that is very, very important for us is the involvement of non-state actors, also present in the room. Therefore, obviously, we strongly support broadening the partnership with non-state actors because we believe that's crucial in addressing global health challenges and obviously finding solutions to it. With regards to GDOs, a topic that we've been discussing in length, and thanks so much for also the briefing that we got, and it clarified many of the questions, I guess, also on our side. We are very thankful and supportive of the standard operating procedures for the GDOs, which certainly improve the operational coherence, strengthen transparency, and ensure alignment with the regional priorities. From our point of view, decisions on new GDOs, especially those on which host country is most suitable to carry out which task, need to be taken carefully and strategically, and this is why we're debating this. Factors like security, local conditions, including the staffing situation on site, as well as the need to avoiding fragmentation, must form the basis for these decisions. And we are grateful for having had the exchange, and we understand that this is exactly taken into account. We also believe that the host countries of GDOs should take on responsibility for their financing to ensure the effective operationalization and sustainability of these offices. I mentioned in one of the meetings that we are proud to host 2 GDOs, one European one and one global one. And for us, that means a financial commitment of more than 33 million euros this year. Yeah? So it's a strong financial commitment, but we also expect the hosting countries obviously to come in with funding. We've been discussing the business cases, and we believe it makes sense. It's certainly understood that we are not giving green light now at this stage, but that if the business cases are going through, then that decision, the main decision on whether we will have GDOs or not, will be taken by the next RC, and we think that's needed because we need the further exchanges on the need, but obviously also there are pressing issues like AI, which can't wait for 2 or 3 more years. With that, thank you very much.
Thank you very much. That was a lot for not being too prepared. So, with that, I would like to ask if someone else, I see Turkey is raising the name. Please, you have the floor.
Thank you, Chair. Turkey believes the GDO strategy is a good option for strategic areas that are not well funded within the WHO. Therefore, Turkey hosts and provides funding for the Istanbul office. We believe all 3 new proposed topics are of strategic importance to our region. Therefore, we support the proposed decision normally, but on the other hand, we understand the concerns of member states, and we are ready for discussion for the next year. Thank you.
Thank you, Turkey. And I would like to give the floor to Poland.
Thank you, Chair, Secretariat. First of all, let me thank you for organizing the informational meeting. It was really helpful for all of us. Poland aligns itself with the statement made on behalf of the European Union and its member states. Poland welcomes the WHO Euro Accountability Report 2025 and commends the regional office continued commitment to transparency, participatory governance and, indeed, accountability during an exceptionally challenging period. We acknowledge the significant governance improvements achieved. In times of unprecedented challenges, Poland particularly commends the WHO Euro's forward-looking digital transformation agenda. The strategic focus on artificial intelligence, digital workplace modernization, cybersecurity, and data-driven decision-making represents, in our view, essential government innovation for a 21st century leading health organization. The timely dispatch of documentation has improved sustainability, demonstrating progress toward greater efficiency. We appreciate the reduction in document volume, which considerably facilitates preparation and engagement by member states. We support the structured approach to considering proposed new GDOs, especially provided their financial implications have been carefully assessed. A transparent consulting process takes time, but it is nevertheless crucial to enabling informed decision-making by the regional committee. Despite the commendable progress in navigating WHO Euro in turbulent times, significant challenges remain. Concerning gaps in funding include such key areas as access to medicine and health determinants. Digital governance infrastructure must help effectively address the current funding sustainability challenge. While technological tools enhance efficiency, they cannot substitute for adequate, flexible and predictable funding. The Polish philosopher Tadeusz Kotarbiński wisely observed in this treatise on good work that efficient action requires reliable cooperation. This principle resonates strongly in our current context. Strengthening governance mechanisms, ensuring transparent accountability, including through timely reporting and fostering genuine partnership between member states and the Secretariat are essential foundations for WHO Euro's effectiveness and continued relevance. Poland reaffirms its commitment to participatory governance and stands ready to work collaboratively with the regional office and fellow member states toward united action for better health in our region. Thank you.
Thank you very much. Poland, is there anybody else from the member states who would like to take the floor? If not, then I would like to open the floor to UN agencies and international organizations. I don't have a list at this moment, so please raise your nameplate if you would like to take the floor. I don't see any, so I assume we can move on to the non-state actors. I'll ask the same thing. Is there anybody who would like to take the floor to comment on the subject? Thank you very much. So I hope everything is clear. So I would like to seek now the response of the Secretariat, and I don't know who wants to get started. If you want, Gabriel wants to get started. Please, you have the floor.
Thank you so much, colleagues. Thank you, firstly, to all the delegations that have spoken for your support for and feedback on the accountability report. This is our third year of producing that report, and it is something that we are co-designing. So we very much appreciate the feedback that you've given and also the elements that you've drawn out in the discussion, including in relation to country support, in relation to staff health and well-being, in relation to the digital transformation, if I'm getting the term right, of our regional office and a number of other areas. We've heard what you said in relation to our staff. This is a really very, very challenging time for all our colleagues. We appreciate the support, but we also appreciate that there is a need to continue to move forward with the staff health and wellbeing agenda in this context. So thank you very much for those comments. On the governance side, I also very much appreciate your comments in relation to our efforts to strengthen participatory governance. This is a priority of our regional director and a personal commitment by Hans. So thank you for that feedback. We will continue to see how we can build the accountability report further as a tool. Thank you to Czechia and to a number of other delegations in relation to SCRC visibility. This is an agenda we've been taking forward together over a number of years, and I very much hear the suggestion around the dissemination of the SCRC reports, not just publication on the website. I think that would also perhaps have addressed some of the issues that we've had during the course of this meeting in relation to the GDO's piece, if there had been wider dissemination. So we very much take that, and I look forward to discussing that with the incoming chair of the Standing Committee. Turning to the geographically dispersed office business cases. Thank you for the very frank exchange and discussion and dialogue during the lunchtime information session. We are designing this together. The SOPs are new. We are building by doing or learning by doing. So we really appreciate the dialogue. Of course, if we had had more time before this session, we would have arranged a briefing and an opportunity for exchange. I agree with delegations that it's a pity that we had to do it during the regional committee, and I really thank all delegations for their flexibility. This is a particularly challenging period for our office, so trying to juggle those items at the same time has been challenging for us. Regarding the timely dispatch of documentation, I think I have to say that this year our statistics are going to suffer, again, because we've been juggling the restructuring process alongside documentation dispatch, and also certain documents could only be produced at a point where they would be useful for member states. And here I'm particularly speaking to some of the institutional documents, including the budgetary documentation. But thank you for the support, and we will continue to seek to improve on our timeliness. I think just one final point with regard to the geographically dispersed office business cases. Of course, this is under the stewardship of the 33rd Standing Committee of the Regional Committee. We have very much heard all of the feedback from the room in relation to how we will approach this during the coming intersessional period. So we've taken that on board, and of course we will discuss with the committee how to ensure that member states are engaged, informed and included in the process through the year ahead. Thank you very much to everybody, and I'll pass to my colleagues if there's anything that they wish to add. I see David has something to add. Thank you.
Yes, thank you. And I think just that there were a lot of comments on the staff well-being, and I think Gabrielle said a lot, and very much so, that right now we're quite concerned for the staff, and we're putting in place a very clear transition plan that includes a lot of work for, of course, taking care of the colleagues right now who will be separating, but even more looking forward. We've hired a number of coaches who are working with our teams to build back and to build new. A lot of our teams are new, are bringing colleagues together who haven't worked together, and of course also managers who are new to their colleagues. So this is an opportunity to start fresh and to start new and on the right foot. And this is a big push that we're making over the next 3 months, and actually until June, to make sure that we start right. At the same time, of course, with less resources, there's also less resources to support what we had started in respectful workplace and in staff well-being. So we have now consolidated our prevention response to sexual misconduct, our prevention response to abusive conduct, and our respectful workplace program, and our staff health and well-being teams into one team. We find this actually, it reduces duplication, optimizing our resources, it enhances coordination efficiency and impact across the region. And it leverages the success that we have had with Persea in changing culture. So I think it's all a win-win. So I just wanted to brief the colleagues on this. On the last point from the Czech Republic, that there was a question on the cost for Istanbul. And I think as the regional director, as Hans mentioned in his speech, we are actually offsetting $8.1 million with our geographic moves. This is since 2022. This is not just what happened this year. The cost of the staff, the cost difference of the staff that we will have by June this year, next year in Istanbul, if they were staying in Copenhagen, is about $7.8 million. Thank you.
Thank you, David. And I think before we conclude this agenda item, I would like to pass the floor to Gabrielle, because obviously I was reading out the sentence, but maybe it would be good to have some more context on this. Gabrielle.
Thank you so much, Chair. So just to reiterate the Chair's proposal for an addition to the conference papers that the Chair will be introducing to the room in a moment, the proposal would be that there would be a third operative paragraph, OP3, which would read, requests the 33rd Standing Committee of the Regional Committee for Europe to report back to all Member States at its open session on the progress made in implementing this decision to ensure transparency and continued engagement of all Member States prior to RC75. What I would like to add to that is that through the SCRC reporting, the reports of the sessions, but also intersessionally, if requested, we will provide further briefings. Thank you.
Thank you. Thank you for this clarification. This brings me to the point that I would like to conclude actually this agenda item, and I think we are ready to consider the adoption of the proposed draft decisions related to the establishment of 3 GDOs, and I suggest we take one by one on this. Firstly, let us consider the draft decision contained in document EUR RC75 conf/7 on the business case for proposed geographically dispersed office on quality of care and patient safety. Is the committee willing to adopt the proposed draft decision by consensus? Oh yeah, obviously with the proposed amendment, obviously, yes, of course. Yes. Okay, thanks. So, yes. So I guess this one. I guess this one is then adopted. Let's move on to the. Well, yeah. It was hard work. You're right. It was hard work. Let us now move on to the next one. The draft decision contained in document EUR RC75 conf/8 on the business case for proposed geographically dispersed office on artificial intelligence. Is the committee willing to adopt the proposed draft decision by consensus, obviously with the amendments that we now discussed? Yes, looks good. That's now adopted as well. Thank you very much. And then, never true without the third one. Let's look at the draft decision contained in the document EUR RC75 conf/9 on the business case for proposed geographically dispersed office on health and the well-being economy. Is the committee willing to adopt the proposed draft decision by consensus with the adaptations that we just discussed? Sure. Thank you. That one's also adopted then. Thank you very much. Yes. So with this, I would like to give the floor to Hans to say a few words on the adoption of the 3 GDOs that we just discussed, and that we will have to work on very much in the next months.
Thank you, Chair. Dear colleagues, we stand together at an inflection point for WHO Europe, marked by transformation, partnership and renewal. The Accountability Report 2025 charts the path of an organization that has not only delivered under pressure, but also evolved, becoming more transparent, more agile, and more attuned to the needs of the Member States. The Member States' participation in the Standing Committee in consultations and through dialogue on reform has ensured that accountability remains not an exercise in reporting, but what we envisaged, a culture of joint responsibility and accountability. As we turn now to the future and to the second EPW2, the spirit of partnership that underpinned this journey will be even more critical. EPW2 challenges us to do differently with less, to focus on impact and to translate our collective vision into measurable health gains for every community. In this context, I would like to express sincere appreciation for Member States' constructive feedback and support during the consultation on the business cases for the proposed GDOs, and to reassure you that we heard all your comments and particularly concerns, and that we take this very seriously forward, to reassure you. The discussions have reminded us that new institutional arrangements must serve the priorities of the EPW2, supporting innovation, quality of care and the well-being economy, while ensuring that WHO Europe remains unified, efficient and country-centered. The coming years will demand discipline, foresight and solidarity. Together, through EPW2, we will continue building a WHO Europe that listens, learns and leads, one that remains accountable to those we serve and guided by the united action that defines our region. Thank you.
Thank you very much, dear Hans. I'd like to give the floor to Gabrielle to talk about the new non-state actors, not official relations with WHO now. So, Gabrielle, you have the floor.
Thank you, Chair. This is the final sub-item under the governance and partnerships item, as the RC needs to consider the application of new non-state actors not in official relations with WHO to be accredited to attend the sessions of the Regional Committee. And indeed, we heard Germany's intervention with regard to non-state actors. It is a regular item of the Regional Committee. Accreditation is a privilege that the RC may grant to regional non-state actors not in official relations with WHO at the global level. It includes an invitation to participate without right to vote in RC meetings and the possibility to submit written and oral statements. And thank you to all the NSA colleagues who are with us for these 3 days. We hope that our piloting of the pre-established speakers list have assisted with your preparations. To support the Standing Committee and the Regional Committee in this process, the Secretariat reviewed all applications received in 2024 to ensure that they met the requirements of WHO's Framework for Engagement with Non-State Actors and Resolution RC67R7 on partnerships for health in the WHO European region. This year, 4 non-state actors met all requirements for accreditation, and the Standing Committee recommends their approval. These are the European Academy of Paediatrics, the European Hospital and Healthcare Employers Association, the European Specialist Nurses Organisation, and the International Association of Mutual Benefit Societies. Their collaboration plans with WHO Europe focus on key regional priorities, including child and adolescent health, the health and care workforce, professional nursing standards, and universal health coverage. In addition, 10 organisations accredited in 2019 and 2022 underwent their triennial review. All were found to meet the criteria for continued accreditation, reflecting strong and constructive collaboration with WHO Europe over the past 3 years in areas including public health workforce development, chronic disease prevention and patient engagement. And we thank those colleagues for their collaboration with us. These are non-state actors accredited in 2019, AFEW International, Age Platform Europe, AIDS Healthcare Foundation Europe, European Federation of Nurses Associations, European Patients Forum, and European Respiratory Society. Non-state actors accredited in 2022, Association of Schools of Public Health in the European Region, ASFER, European Diabetes Forum, European Society for Clinical Nutrition and Metabolism, ESPEN, and Long COVID Europe. Thank you, Chair.
Thank you very much, Gabrielle. This then also concludes this agenda item. We are now ready to consider the proposed draft decision contained in the document EUR/RC75/conf/1 on engagement with non-state actors, accreditation of regional non-state actors not in official relations with WHO to attend meetings of the WHO Regional Committee for Europe. I'm asking you, is the committee willing to adopt the proposed draft decision by consensus? I see no objection. Therefore, the decision is adopted. Thank you very much.